All right, so now I am going to demonstrate an upright heel for you. Keep in mind it's going to be the same view as we do when they're supine, right? An axial view and a lateral view, except for this time now they'll be standing upright. So I put the stairs here facing this direction because it's going to be her right foot. That way she can step on either side of the IR and have something to hold on to. Okay, so we'll have you step up there. All right, we want a 40-inch SID, which I already checked. So as far as centering goes, so you kind of see how her heel is more on the closer to the edge of the IR. I'm going to have you just move your foot forward. Try to get it as centered as much as you can on the image receptor. So we do a calcaneus for the lateral. We want to center an inch below the medial malleoli. So if you feel for the lateral malleoli, that sits about an inch below. So you can actually get center on the lateral malleoli when you're coming in from the lateral side. Then you can collimate much more than you do with an ankle. We don't need to get as much of the lower leg as we do when we do the ankle. And then you're going to have a little spot here on the anterior portion there to put your right marker. So this would be the standing upright heel. Okay, so now we'll do the axial. Okay, so for this one, you're going to have the patient put their foot, I'm just going to have you bring it back a little bit, your foot back, there you go. And what you want them to do is kind of lunge forward because you want to get rid of the soft tissue of their back. So now for this, we're just going to put our angle on. Again, it's going to be slightly higher. Instead of a 40-degree angle, we use a 45-degree. And then you're going to come in and you want to measure your 40 inches. And you want to stay centered in between the malleoli, and so that this line here is exiting about the level or where the base of the third metatarsal is going to be. So instead of entering that, which we do on the table, you want to exit that when you're doing it upright. Then as far as collimation goes, you want to make sure that you have light past the heel. And then again, leave a little light so that you can mark laterally with your right marker. And that is the upright tangential.